In the center, it consists of a fibrous tissue, a fibrous plate that is known as the tarsal plate. Here it is written as tarsus. On the anterior aspect of the tarsal plate, there is presence of the orbicularis oculi muscle, and there is presence of the tendon of the levator palpebrae superioris. This muscle, you can see it is coming and inserting on the anterior aspect of the tarsal plate. So tarsal plate is basically thickened lower portion of the orbital septum shown here, that is attached to the orbital margins, and it comes all the way down to the tip of the eyelids. So this is about the tarsal plates. The muscles insertion, the orbicularis oculi and levator are anterior to it. A little muscle, some people consider it a part of the levator palpebrae superioris, that attach to the top of the tarsal plate. It arises from the levator palpebrae superioris and attached to the top of the tarsal plate. This is called the superior tarsal or Müller's muscle. So it has a role in the opening of the eyelid and a part that is majorly supplied by the sympathetic supply. So this is the eyelid, orbital plate, the tarsal plate. Medially and laterally, there is a presence of a ligament, that is the medial and lateral palpebral ligament. We saw them in detail. They are not very clearly shown in these pictures, but they are present, and we saw them in detail when we talked about the um, muscles of the facial expressions. I can show you in the 3D model here. So this is basically the medial palpebral ligament. The medial palpebral ligament gives insertion and origin to the orbicularis oculi, the palpebral part, and it is giving insertion to the part of the levator palpebrae superioris also. So they are making the medial and lateral aspect of the eye, and these are the palpebral ligaments. Then there are different glands that are present inside. There are a set of glands that is present inside the tarsal plate. These glands are known as Meibomian glands. These are sebaceous in nature. And they open up on the tip of the eyelid, just behind the eyelashes. Just behind the eyelashes. Then there is set of two set of glands, that is gland of Zeis and gland of Moll. Gland of Zeis is sebaceous glands, and like the sebaceous gland in rest of the body, they do open into the hair follicle. It is I don't have very nice pictures for that right now. The gland of Zeis that opens onto the hair follicle, and through the eyelashes opening, it comes to the surface. And the glands of Moll, they are apocrine sweat glands, serous in nature, and they open between the hair follicles, that are the eyelashes on the tip of the eyelid. And last but not the least, we are left with lacrimal apparatus, the apparatus that produces the tears. The lacrimal gland is present on the superolateral aspect of the orbit, just below the floor of the just below the roof of the orbit, at the junction of the roof and the lateral wall. That is the lacrimal fossa right here, in which the gland is present. The gland is divided into two parts due to the passing through levator palpebrae superioris muscle. The part that is superior to it or deep, that is known as orbital part, and the part that is present below it, near the eye, superficial to it, that is the lacrimal part, palpebral part, because it is present near the eyelids, palpebral part. These are opening through multiple small opening into the fornix, into the conjunctival fornix. And in the conjunctiva, they are secreted here, and they get into the conjunctival fornix here. Conjunctiva we can talk about it here. Conjunctiva, it is shown by a white line in this picture. Conjunctiva covers the inner aspect of the eyelid, palpebral conjunctiva. It covers the outer aspect of the cornea, bulbar conjunctiva, and it turns around the angle, and that is known as conjunctival fornix, the superior one up, inferior one below. So if the eyelids close, these two margins meet and the conjunctiva form actually a type of sac, a type of space in front of the eye. So these are the conjunctiva, and it is opening into the superior conjunctival fornix. If you see blinking, Google blinking in a slow motion camera, the lateral part of the eyelid close first and they go on to meet towards the medial aspect. So this eyelid help this lateral to medial closing that is not visible in our normal eyes. You can see only with a high speed camera. It push the lacrimal, the tears towards the medial aspect of the eye. They come here, and when they come here they reach on this aspect. This pinkish area below the medial angle of the eye, this is known as lake for the tears, the tear lake, the lacrimal lake, the lacus lacrimalis, this whole area. Here there is a mountain inside, there is a raised area that is known as lacrimal caruncle, and just in the valley of this uh, caruncle there are two openings on the two medialmost part. These are lacrimal papilla, the raised areas of the skin, and on the top of it the openings are known as lacrimal punctum. The tears, the lacrimal secretion that come, they move medially, they gather here, and they are drained through these openings. They are drained through these to the lacrimal canaliculi, and from here it goes to the lacrimal sac, and from the lacrimal sac they go through the lacrimal duct, nasolacrimal duct, and open into the inferior nasal meatus and nasal cavity. So this is the pathway for the tears, that is pathway for the lacrimal system, and any disruption in it can lead to it flowing outwards. For example, emotional or irritational, there is increased production of the tears. The production surpasses the drainage capacity and it will lead to the tears going outside. Even when you see a person who is going to cry, there is accumulation here in the lake and inferior the lower along the lower margin can be seen the tears about to fall out. And the other thing is there may be a blockade in the canaliculi, in the puncta, that may lead to the secretion going outside. So this is all about the lacrimal apparatus, and the lacrimal apparatus we discussed a little its sensory supply. That parasympathetic supply to the lacrimal gland is coming originally from the facial nerve. It has moved through geniculate ganglion, greater petrosal nerve, nerve of pterygoid canal to the pterygopalatine ganglion. Here the preganglionic fiber synapse and the postganglionic fiber go through the connection to the maxillary nerve, then nerve, then zygomatic-temporal, and through then communicating branch to the lacrimal nerve that brings it to the lacrimal gland. The similar pathway is from the sympathetic. Sympathetic fiber reaches the pterygopalatine ganglion through the deep petrosal nerves when it joins the nerve of pterygoid canal. It reaches the pterygopalatine ganglion, and from here to the lacrimal gland, the pathway is the same. So that's it. Thank you for bearing with me. I hope it helped you with developing the concepts of orbit and the structures, orbit, the eye, and the related structures. If you have any questions, suggestions, feedbacks, please mention in the comments below. And inshallah, see you in the next lecture. Till then, good luck and Allah Hafiz.